Hi, everybody. This is Marisa Benitez in regards to the COVID-19 crisis, aka the coronavirus, and my three standpoints. So the first one will be my personal standpoint. The question asks, what different information have I used to assess the situation? Who have I communicated with, and what are my outcomes? So the first one on my list is definitely the CDC, letting us know on the updates that are going on around the world. The second would be my county website, letting us know what's going on in our county. What are the shutdowns, shelter at home, curfews, everything that's going on in the city, that we were up to date with everything. Who have I communicated myself with? Definitely my parents, making sure they have everything they need so that they stay at home and stay healthy, making sure they have their medications, their vitamins, enough food, enough Lysol wipes, toilet paper, that chaos is going around everywhere in the grocery shopping, HEB, Walmart, whatever it be, making sure they have everything they need. And it's very hard to believe everything you hear or see on the news or Facebook, but following the correct news outlets, the CDC especially, making sure we have the accurate information is very important, especially having to do with school district, because the kids staying at home, the parents have to work, what's going to happen with them and whatnot. But also focusing what's important, the health of everybody in this county. The second standpoint would be my work standpoint. What information has been used to make decisions about work? How has my school and job communicated with me? So I'm currently working from home. We're using OneDrive and Microsoft Teams, to communicate with each other. That's been this past week. We were currently in spring break last week. So letting us know that we're available, and, being able to contact with everybody who we can, and the director and our specialist. Mad props to Columbus State, man. They've been really keeping us up to date daily with the updates, which is having to do with the transitioning to online learning. I mean, our class is already online, but it's really tough transitioning, because that's currently what I'm doing right now, helping faculty transition into the online world. So that's awesome. How's my school communicated with us? So the weekly meetings that the deans of academic affairs have been meeting, the VPs, the department chairs have been meeting, letting us know what should we expect and who is actually supposed to be inside the institution, because it needs to stay running. We have students attending classes, and they need to be able to be in contact with someone at the college, and also with us as specialists who assist them with whatever they need. So, and the last one is my overall standpoint. It's kind of hard. It's very hard, especially when you see tweets, Facebook shares, about different things. There's one specifically about the U.S. Senator of Connecticut that tweeted on February 5th that he had just left a briefing on the coronavirus, and bottom line that they weren't taking anything seriously, and they weren't requesting for any emergency funding. That's a big mistake. That's February 5th, dated February 5th. If people would have taken that seriously from the very beginning, all of our hospitals, our clinics would be a lot more prepared in how fast the virus is spreading. So I would grade the U.S. a D. I feel they have a lot more means, a lot more money to share with everybody to get the necessity, the PPE, all the masks, everything that they need to stay safe. So, yep, that's my video, and I hope everybody's staying safe. Use hand sanitizer and stay home.